Good afternoon, and thank you for joining us for today's webinar, Put a Stop to Poor Care, Advocating for Quality Care. I'm Robin Grant, Director of Public Policy and Advocacy with the National Consumer Voice for Quality Long-Term Care, otherwise known as Consumer Voice, and we're hosting this webinar in collaboration with the National Center on Elder Abuse, which we will refer to as NCEA. Next slide, please. The purpose of today's webinar is to provide a basic framework to help you identify quality care and potential issues, not to provide an in-depth advocacy training for specific care issues. The indicators of care and advocacy steps we will discuss are not comprehensive, but they represent the core aspects of quality care and practical steps to take to address concerns. So here's what we have planned for you. After a quick review of webinar logistics and an introduction to Consumer Voice, we will hear from Julie Shane, Deputy Director of NCEA, and then I will share some indicators of quality care and warning signs of poor care, and talk about strategies to help you advocate for yourself or a loved one. Next, Kathy Bradley, a family member, advocate, member of the Consumer Voice Leadership Council, and founder of Our Mother's Voice, an advocacy organization in South Carolina, will talk about how individuals can support a loved one who is a resident of a long-term care facility. In the final part of our presentation, Amity Overall-Labe, Acting Director of the National Long-Term Care Ombudsman Resource Center, which we call NORC, will provide an overview of the Long-Term Care Ombudsman Program, including how and when to seek ombudsman assistance. We will then give you time for questions and end by letting you know about some resources that are available to you. So a word about logistics. First, all lines will be muted during the presentations. And second, if you have a question at any time, please post your question using the chat feature on the right side of your screen. We'll keep track of incoming questions and then do our best to respond during the question and answer portion of the webinar. You also have the option of raising your hand to ask a question, and we will unmute your line. And one last point. This webinar is being recorded and will be available in the near future on our website along with the resources mentioned during this training. Next slide, please. For those of you not familiar with our organization, Consumer Voice is a national nonprofit organization that advocates for people receiving long-term services and supports in all settings. So that's in their own homes, assisted living facilities, or in nursing homes. We have a clearinghouse of information and resources to empower consumers, families, long-term care ombudsmen, and others in advocating for quality care, as we say, no matter where. We also provide technical assistance and support for state advocacy regarding long-term care services and supports, and have a national advocacy action network. So that's who we are. Joining us is Julie Shane, Deputy Director of the National Center on Elder Abuse. So I want to give Julie a few moments to say a few words. Julie?
Thank you so much, Robin. What an honor and a pleasure it has been to work with Consumer Voice. I've long been a fan of their materials and their articles, and is now part of the National Center on Elder Abuse. It is just such a privilege to collaborate with them and with so many others. For those of you who aren't familiar with the National Center on Elder Abuse, I hope you can at least take this away with you today and know to come to us if you need any assistance in any issues surrounding elder abuse. I think many of you are very familiar with what we do. We are one of 27 national resource centers funded by the Administration on Community Living, and we are providing you with all types of educational resources, training curricula, research that we really are trying to work on and to bring up to the minute, and it's been a challenge, but we're really working on that. I'm most proud of our ability to work with so many great partners and make those connections. I think of NCEA as a big convener of all these great ideas throughout our country that all of you are working on. And so bringing those to our attention and sharing those with us, we will put them out through our listserv and our website and make sure that people have access to them. We're always looking for innovative models, and we want to hear what you need. So we are hoping that all together, collaboratively, like today's webinar, we are able to advance the field and communicate this to others and make sure that people have access to this information as we all move forward on our respective missions. Next slide, please. And so I think these are the major things that I'd like you to take away today. I'm not sure if a lot of you know that we do provide technical assistance through our phone line and through our website and email and social media. Tomorrow we have a great Twitter chat on capacity issues that's going on, and that went out today to our listserv. So if you're not a member, please let us know. We make lots of news and resources available, and we have a great monthly theme blog that we're doing, and then a Twitter chat on the third Thursday of every month. And it just amazes me the people that are on the line and we bring together. We're always, again, as I mentioned earlier, looking for those promising practices and interventions, and hoping to provide you with subject matter expertise, but also learn from you on a daily basis, which I truly am. So again, my thanks to the whole Consumer Voice team. They've been nothing but a joy and professional to work with. And now let's really get into the important material they have today. Thank you so much.
And thank you, Julie. So now let's look at quality care. Regardless of where an individual receives long-term care services and supports, they are entitled to receive quality, individualized care. So what does quality care mean? Quality care promotes resident dignity, choice, and self-determination in all aspects of life and care. So providing quality care means that each resident's care is individualized in order to meet their needs and preferences. To determine those care needs and preferences, staff must work with the resident and their family members and/or representatives to gain a comprehensive understanding of what is important to them in their daily life and how they can best meet their care needs. Now, some residents may have limited capacity due to dementia or mental illness, but they should still be involved in their daily care and life decisions as much as possible. Next slide, please. So individuals living in nursing homes and assisted living facilities maintain the same rights as individuals in the larger community, and in fact have additional rights and protections under federal and/or state law. All residents, regardless of the type of facility, have the right to be protected from mistreatment, including abuse, neglect, and exploitation. Nursing homes have to meet federal requirements in order to participate in Medicare and Medicaid. Those requirements include residents' rights and require that residents receive services and activities that, and I'm quoting from the law here, attain or maintain the highest practicable physical, mental, and psychosocial well-being of each resident in accordance with a written plan of care, and that a facility care for its residents in such a manner and in such an environment as will promote maintenance or enhancement of the quality of life of each resident. So that's nursing homes. There are no federal regulations for assisted living facilities, which, by the way, may also be known in your states as board and care or personal care homes. There are a host of different names for these facilities. And the requirements, because there are no federal regulations, the requirements are different in each state. But Despite the regulatory differences between nursing homes and assisted living, the indicators of quality care and advocacy steps that we'll discuss today are applicable in all long-term care facilities. Next slide, please. Quality care encompasses more than just meeting the medical or physical care needs of individual residents. It also means providing a warm, home-like environment that enables residents to participate in daily life and meaningful activities based on their preferences and choices. So I want to outline for you a few indicators of quality care. And these are not only signs of quality care, they are also signs of individualized care. So what do they include? First, quick and kind response to call lights. Resident involvement in care and daily life is encouraged. So, for example, residents are encouraged to participate in their own care plan meetings. Join resident councils. They're encouraged to provide feedback on daily life in the facility. Choose when they wake up and set the schedule for their daily life and activities. Quality care includes residents who appear clean, well-groomed, comfortable, engaged, happy, and without visible restraints. It means that the facility is clean, clutter and odor-free, and maintains a comfortable temperature. Food is appetizing and residents are offered choices. The community is warm and engaging. It's a welcoming environment where staff, residents, and visitors interact with each other. Quality care is staff knowing residents and communicating respectfully. Staff know and respect individual resident preferences and routines. And finally, there are meaningful individual and group activities. Next slide, please. Regular visits and communication with and between staff, residents, and family members are critical for achieving and sustaining quality care. And even if you or your loved one is pleased with the care and quality of life, it is still important to be involved in the community and communicate with those that live and work in the facility. So here are some tips to help keep those lines of communication open. Get to know other residents, especially those without family or visitors. Get involved in the resident or family council. If there isn't a family council, start one. And if you're a resident, help make sure the resident council is truly resident-led instead of led by a staff member with limited resident involvement. And so we have resources on our website to help support and empower both resident and family councils. So there's a lot of information out there. Share information about residents' rights and signs of quality care. Share the brochure that goes along with this webinar and other fact sheets or materials regarding residents' rights and individualized care with residents and families. Communicate with staff and make a point of complimenting good care. I think staff and facilities don't hear about the good things they do. Far too often they just hear the negative things, so compliment good care. Learn about the Long-Term Care Ombudsman program and get to know your local ombudsman. Later we'll share more information about the Long-Term Care Ombudsman program and how to contact the program so that you know where to turn. And last, if you're a family member or friend, continue to visit often and at varying times in order to observe care during different times of the week. Next slide, please. Now we're going to look at warning signs. So you also need to be aware of these. So let's talk about what indicators of care indicate that there are issues that you need to be aware of. So, warning signs. The facility appears understaffed. So, for example, call lights are not answered promptly or turned off without care being provided. Residents' rights are not respected. So, for example, there are no choices in daily routine. Residents aren't involved in care decisions. The quality of food declines. So maybe there are fewer meal options. There's less food that's served. The menu isn't followed. There's high staff turnover and staff that are not familiar with residents. Residents appear bored, less active, not engaged with others or activities. Residents and/or family members say that concerns have not been resolved. The facility is uncomfortable, so it's not clean. There's an odor. It's too cold, too hot, or too noisy. And lastly, there are medication errors. Next slide, please. So what can you do when you see these warning signs? So here's some advocacy tips to help in that situation. So work with the resident or family council to address concerns as a group. Remember that saying, there's safety in numbers? It's certainly true, and councils can help with that. Become familiar with residents' rights and facility requirements, and you really want to know both the federal and the state requirements. Document your concerns. Discuss your concerns with the administrator or other key staff, such as the director of nursing. Share your observations and share your resolution goal. Contact the Long-Term Care Ombudsman program for assistance with your concerns. Visit frequently and vary the time of your visits, and make sure to take notes of any issues you identify. And review state survey reports, and these are inspection reports, to see if the facility has been cited for similar issues before. Next slide, please. So as you can see, we've gone from green light to yellow, and now we're at red flags. These are indicators of significant care issues and concerns that need to be addressed. Now, here are some of the things to look for. You notice a significant sudden change in the resident's behavior, such as lack of appetite, fearfulness, or anxiety. There are dramatic physical changes, such as weight loss or a decline in mobility. There are unexplained injuries and/or bruises. Residents are physically restrained and/or appear to be over-medicated, so you might see residents slumped in wheelchairs. There's a severe lack of staff. So, for example, there's no response to call lights. There are frequent falls. There's lack of assistance for residents to use the restroom. All signs of poor care. Residents appear unclean and have body odors. Staff disregard residents and their rights. Residents are not treated with respect. Resident preferences and choices are not encouraged or honored, and complaints are ignored. And finally, missing personal items or funds. Next slide, please. These red flags are indicators of serious issues in care and quality of life. Some of these red flags could lead to or are, in fact, the result of resident mistreatment, such as abuse, neglect, or exploitation. In these cases, it's really important that you speak with facility staff and/or an outside agency about these concerns as soon as possible. So here are some steps to addressing and/or reporting some of these red flags. First, take detailed notes of concerns. So write down names, dates, times of incidents. Contact the facility owner and/or corporate office and share your concerns. Contact the ombudsman if complaints are not resolved, or if staff is unresponsive and/or you need information or advocacy. contact the state survey agency to file complaints, and make sure when you do that to be as specific as possible and to give as many details as possible. That really helps the investigators if they have as much information as possible. And certainly report any suspected abuse, neglect, or exploitation to the investigating agency, which could be Adult Protective Services or the State Survey Agency or perhaps even another agency, and also report to local law enforcement. Next slide, please. Above all, don't ignore the issue or wait too long to share your concerns, because it's best to address concerns clearly, directly, and promptly. How you present the problem is really important in order to have effective communication and problem solving. So we want to take just a moment here to give you some quick tips for how to communicate with staff about your concerns. First, before speaking with staff, define the issue. So make sure to stick to the facts, your observations, and resident direction, so what the resident is telling you he or she wants to happen regarding care needs and preferences. The second tip, focus on the problem, not the person, and avoid using emotive words that are tied to a person's perception. For instance, avoid saying you, because that focuses on the person, and avoid asking why, because that can make people feel they're being accused or attacked. Tip 3, be direct, specific, and non-judgmental. Describe the situation without sharing your opinion about why it happened. Be factual. And last tip, discuss your resolution goal, what you want to have happen. And document everything, and then follow up with staff if the issue is not fully resolved. Next slide, please. Okay, let's take a look at some examples of how you would implement the communication tips that I just covered. I'm not going to go through all 4 of these, so I urge you to look at and study all 4 of them, but I am going to cover a few here. So the first one I want to look at is the one at the top, where it says, avoid saying, "Why are the aides so late in responding to my call light after dinner?" So problems with saying it this way. First of all, the why is accusatory. It's kind of pointing the finger at someone, and framing it that way is going to make people feel much more defensive than if you phrased it differently. And expressing it in terms of so late, first of all, that's not very specific. What does so late mean? And it's also somebody's perception and judgment. One person so late is not necessarily late for somebody else. So it's vague also. So instead of saying it that way, say it this way. I need assistance getting to the restroom after dinner, and for the last 3 nights, I've had to wait for at least 20 minutes. How will this be addressed so I get the help I need? So this lays out the facts instead of saying so late, and it asks, how will this be addressed, instead of saying why, which again can feel like you're being accused. And then I want to go to the third example. So you want to avoid saying, the evening aide barged into the room. So the word barged has a negative connotation for most people, and it really is someone's perception. So you could consider that to be sort of an emotive word. So instead of saying it that way, say, she came into the room suddenly while my mother was sleeping. So this takes the emotion and the negative judgment out and just leaves the facts. So we can't emphasize enough how important communication is. I think it can create a barrier or build a bridge. And what you're trying to do is build that bridge. So remember to really think about your communication. And now I'm going to stop, and it's my very great pleasure to turn things over to Kathy Bradley to share her perspective as a family member and advocate. Kathy.
Thank you, Robin. I just want to echo what Julie said about her positive experiences with the Consumer Voice. It is an amazing organization with outstanding staff, and I want all the participants to know you've gotten in touch with a very high-quality organization when you've gotten in touch with Consumer Voice. Our Mother's Voice was established as a result of our family's experiences and our efforts to secure appropriate care for our mother in her nursing home. So when I talk about what you can do, it's based on my experience and the experience of others that we have helped. The best thing advocates can do is to arm yourselves with knowledge of the federal and state laws and regulations governing the long-term care setting that you or your loved one is in, and gain an understanding of how those laws and regulations should translate into real-life practices by the provider and experiences for the person receiving care. Learn and use the language of the regulations, because when you know the laws and regulations, you realize you are not alone. You realize you're right in your concerns, and you have the power of the laws and regulations as a partner at your side when you advocate. Now, I want to say that while I speak mostly to family members advocating for loved ones in nursing homes, these principles apply equally to consumers, ombudsmen, and other advocates, and also translate well to home and community settings. Next slide, please. So, how do you use this knowledge to make changes? Stay involved with your family member after he or she is placed in the nursing home. As Robin said, visit often and at varying times. Learn the plan of care and make sure it meets your loved one's needs: physical, medical, social, psychological, spiritual, and takes their personal preferences about foods, activities, and daily schedules into account. Provide information to staff that will help the plan of care to be complete and meaningful. Communicate regularly with your family member's social worker and other staff. When you visit the facility, observe your surroundings, your loved one, other residents, the building, the staff. Note anything good and let the staff know. Note anything that doesn't seem right. Look for trends, more than one occurrence of that thing. How do staff respond when a resident asks for help? Do they respond to call buttons going off? And how long does it take? What does staff do if a resident wanders out of her room partially closed? Make written notes of your observations with dates, times, names of staff present, and details of what you saw or heard. This will help to take emotion out of the equation, as Robin mentioned earlier. It'll help your memory later on and help to define specific issues clearly. I can't overemphasize what a significant tool these notes are. Ask questions of the staff. When does the next activity begin? What is Dad's favorite activity? What's happening at shower time? How is Mother sleeping? How has her appetite been lately? And work with the staff if you see anything that needs attention, even if it's not a trend, because if it's not addressed, it could become one. And by work with staff, I mean, for example, offering helpful tips, like when my mother gets agitated, she's trying to tell us she wants to leave the activity or the room. Or if my mother gets resistant to personal care, try just stepping back and approaching her again later when she's calm. Working with staff is also bringing potential issues to staff's attention when you see them. For example, I noticed that Mr. Jones is often asking for help with finding his room. Or, I noticed this mop bucket was left in the middle of the hallway. Again, become familiar with the facility policies and state regulations that apply so that you know what should be happening. Identify specific problems or violations and talk with management staff. Ask about the facility policy on any practice that you have a question or concern about. For example, how staff assure that personal property is used only by the resident it belongs to. Protocols for when and how to send residents to the hospital. Whatever it is that you may have a question about. By the way, you can access the federal regulations at Our Mother's Voice website, www.ourmothersvoice.org. It's at the bottom of the homepage. We have a link, and we also have a link at Quick Links, which you can access from that homepage. And there are other websites where you can find those regulations as well. Now, if violations or problems persist, approach the facility administration and then the corporate leadership if necessary. Don't feel uncomfortable doing this, because if your loved one is suffering, so are others. And by this time, you've already attempted to work with the staff. And this is often the only way to hold them accountable. We hear advocates say sometimes that they fear retaliation for taking a stand against problems they've identified. But retaliation is illegal and really only adds to the list of offenses. Providers know this, and if advocates know it, they have a powerful tool. So when you approach the leadership, cite the policies and regulations that are in violation and give examples of your observations and your efforts to work with the staff to correct them, your resolution goal. And this is where your detailed written notes help. You'll be factual, thorough, and accurate when you approach these officials and not emotional or accusatory. Ideally, this approach should be effective and you should see positive changes not only for your family member, but for other residents as well. Next slide, please. However, if these efforts fail, the state regulatory agency has a complaint reporting process. The regulatory agency will refer you to their staff that take reports of complaints or violations. They will need the information you have in writing. It will be essential for them to have sufficient information to pursue your concerns. Quote, "They aren't treating my mama right," unquote, is not good enough to launch an investigation. But your knowledge of the regulations and your ability to provide specific documentation of violations of specific regulations will be very useful. The regulating agency will determine whether investigation is warranted. Ask them to let you know. And if they do investigate, ask them to give you an approximate time frame for their investigation. And follow up with them after they've completed the investigation to learn what they found and what to expect the facility to do in response. Many facilities have family councils organized to provide families with a voice and a venue to discuss and learn and interact with the facility administration on behalf of all residents and their families. Often these councils also occasionally conduct special activities for residents, and you may want to become involved with the family council. As Robin said, if there is no family council, you may want to consider starting one. Our Mother's Voice encourages advocates to approach the regulatory agency because they can not only impact individual situations, but address needed systems changes. And that's the kind of advocacy that our mother engaged in her whole life. There is also a long-term care ombudsman program in each state which accepts complaints and responds with an individual follow-up to the complaint. Amity is going to tell you more about that in a minute. We have links to all the ombudsman programs available on our website, as does Consumer Voice. So to wrap up, we've seen that following these steps has helped many families to overcome barriers to quality care and services. Typically, just knowing what to ask for and knowing and using the language of the regulations when asking is sufficient to convince providers to abide by their responsibilities. This is why we advocate teaching families the jargon. Knowing there's an agency that has the authority to hold facilities and providers accountable and going to that agency if need be is very empowering for families. And remember, although sometimes families fear their loved one will be mistreated in retaliation for complaining about problems, retaliation is illegal. And fear of retaliation just allows the problems and mistreatment to continue. Only strong advocacy will affect change. So now I'll turn it over to Amity.
Thank you so much, Kathy. We really appreciate hearing your perspective and your advocacy tips. So, good afternoon, everyone. As Robin mentioned earlier, all residents have the right to quality care and to be free from mistreatment. For my part of this webinar, I'm going to provide a general overview of the Long-Term Care Ombudsman Program, highlighting the role and responsibilities of the program. First and foremost, the Ombudsman Program advocates for the quality of life and care of residents in nursing homes, board and care facilities, also known as assisted living, and other similar adult care homes. And the program and the Ombudsman representatives are resident advocates. As Kathy just mentioned, every state has an Ombudsman program, but each state operates their program differently. Therefore, this presentation will only address the program responsibilities required by federal law, so the information is applicable in every state. At the conclusion of my presentation, you should have an understanding about what the Ombudsman program does, who long-term care ombudsmen represent, and how to work with the program. The state long-term care ombudsman is responsible for operating the statewide program. And the program is designed to be a local community program utilizing staff and volunteer ombudsmen to visit residents in their local community. In fact, there are nearly 600 local ombudsman programs across the country, and there's 53 state programs. According to the Older Americans Act and the new Long-Term Care Ombudsman Program regulations, responsibilities of the program include identifying, investigating, and resolving complaints made by or on behalf of residents, educating consumers about residents' rights, good care practices, and other related topics, including state and federal requirements, providing information to the public regarding long-term care facilities, how to find one, explaining how the state surveys facilities and so on, resident rights, as well as legislative and policy issues that impact long-term care consumers. The program is also responsible for educating providers about residents' rights, good care practices, preventing abuse and neglect, and other issues regarding quality of life and quality of care. Ombudsmen also help develop and support resident and family councils by providing information and assistance in either starting one or strengthening the current council. Ombudsmen also advocate for improvements in the long-term care system globally that will benefit residents of long-term care facilities, which includes representing residents' interests before governmental agencies and seeking legal, administrative, and other remedies to protect residents. So, as I've already touched on a little bit, the primary responsibility of the program is to serve as the resident advocate. Ombudsmen support resident-centered care, and residents guide all ombudsman work. So residents are always the touchstone that ombudsmen go back to before proceeding and during investigations of complaints. So for example, ombudsmen need resident consent before sharing information, resident or their legal representative consent. The resident guides ombudsman action. I'll explain that in a couple slides later. Ombudsmen seek to resolve complaints to the resident satisfaction. So although ombudsmen are extremely knowledgeable in state and federal requirements, they are not resolving complaints to see if the facility is in compliance with those regulations. Rather, they're trying to advocate on behalf of the resident to reach a resolution that the resident is happy with. The Ombudsman program represents residents' interests in all that they do, whether that's an individual complaint at a facility for one person, or perhaps a group of residents, maybe the resident council in dealing with that facility, or even a chain of facilities if there's some systems issues there, or locally or statewide, the Ombudsman could be looking at some systems advocacy to change how and improve how the long-term care system works for residents. And of course, Ombudsmen empower residents and promote self-advocacy. Information is power, and that is one thing that Ombudsmen do really daily whenever they speak with residents, is explaining their rights and how to resolve complaints and how to empower themselves in moving forward with complaint resolution. As stated earlier, Ombudsmen need resident permission prior to investigating a complaint or referring a complaint to another agency. This is due to federal confidentiality requirements of the program, and it is what makes the program so unique and different from other Older Americans Act programs and services. This chart will give you a better understanding of the Ombudsman role compared to other agencies and programs. So for example, Ombudsmen do not conduct licensing and regulatory inspections or investigations. So like I said a slide back, they are not seeking substantiation of a complaint to see if a facility is in compliance with state or federal regulations. That is the job of the state survey agency, also known as licensing and certification or licensing and regulatory. Ombudsmen use the federal and state regulations and refer to them as they advocate for the highest quality of care and life for residents. And if necessary, with resident consent, Ombudsman will file a complaint on their behalf or assist them and inform them how to file a complaint on their own with licensing and regulatory. The Ombudsman program are not adult protective services investigators. They provide information regarding the prevention of, identification of, and reporting of abuse, neglect, and exploitation, but they are not and should not be the official finder of fact, going out to substantiate a complaint of abuse to the level that APS would. They do not have the same standard of evidence that's required to do so. Again, similar to the first bullet point I mentioned with licensing and regulatory, if necessary, with resident consent or permission of the state ombudsman, if the resident can't provide consent and does not have a legal representative, the ombudsman can file a complaint about alleged abuse with APS and or licensing and regulatory, depending on who is that primary investigator of that specific facility type in that specific state. Ombudsmen do not provide direct care for residents. They do provide in-service training for facility staff about quality care practices and ways to enhance the quality of life and care for residents, but they don't actually provide that care or demonstrate how to provide that care. But ombudsmen certainly are a resource for staff training and provide that information. Ombudsman programs visit residents in nursing homes and assisted living and / board and care homes, depending on what they're called in your state. But in a small number of states, ombudsman programs also visit individuals that receive long-term care services and supports in their own home. Ombudsmen do represent all residents in the long-term care facility. If you're familiar with Older Americans Act programs, such as programs run through area agencies on aging, there is an age requirement of serving individuals 60 and older, but ombudsmen do assist residents younger than 60, as that advocacy for that individual could benefit others in that facility that's over the age of 60. Ombudsmen regularly visit facilities in order to provide access to the program, but how often they visit a specific type of facility depends on the actual program in the state. Sometimes Ombudsman will visit weekly, monthly, or quarterly, depending on the coverage of the state, the size of the state, the type of facilities, whether the Ombudsman program utilizes volunteer ombudsman or not, and so on. So there's a lot of variation there. The next two slides are addressing kind of frequently asked questions that we get about the Ombudsman complaint investigation process. And so hopefully this will help provide a better framework about the Ombudsman role in complaint resolution. But Ombudsmen do investigate individual complaints as well as address concerns that impact several or all residents in a facility. Ombudsmen can also act as the complainant in a complaint in order to address general concerns that they personally observe. So like Robin was talking about in the care indicators, if they observe an odor, if they observe environmental issues that are of safety concern or just uncomfortable, then they can discuss that with the staff. During complaint investigations, Ombudsmen cannot share information without resident consent, and some residents do ask to remain anonymous whenever they ask Ombudsmen to try to resolve a complaint. And that can be challenging, but Ombudsmen are trained with several other options for advocacy strategies in order not to reveal the resident identity. So it is possible to still investigate and resolve that as best as possible. Ombudsmen investigate to gather facts, so they are neutral whenever they're gathering the facts to investigate a case, but they are an advocate in resolving the case and the issue to the resident's satisfaction. And Ombudsmen call upon others to fulfill their responsibilities to residents. For example, Ombudsmen are not supposed to do the job of a social worker in a facility. However, Ombudsmen are supposed to call upon that social worker to do their job to benefit residents. So Ombudsmen, their role is to encourage others and advocate for the resident in order to get other people to do their job in order to respect the resident's rights, choices, and preferences. The resident is the Ombudsman's client. Therefore, complaint investigation and activities are resident-directed. The Older Americans Act requires that Ombudsmen have resident consent prior to investigating a complaint or referring a complaint to another agency. When someone other than the resident files a complaint with the Ombudsman program, the Ombudsman must determine, to the extent possible, what the resident wants. So after receiving the complaint, the Ombudsman will visit the resident in order to understand the resident's capacity to make decisions before moving forward with the complaint. As Robin said earlier, many residents, even residents with dementia, are able to express their wishes. If the resident wants the Ombudsman to act on the problem, the Ombudsman will investigate the complaint and continue to communicate with the resident throughout the process. However, even when a resident has limited capacity, it's still important that the resident has the opportunity to participate in decisions regarding their daily life as much as possible. For example, if a resident has a family member that's their legal representative, yet the resident still has capacity and can express their wishes and preferences, the Ombudsman would work with the resident and follow their wishes. If the resident cannot indicate to the Ombudsman what he or she would like and is not able to provide consent, the Ombudsman assumes the resident would want his or her health, safety, and welfare protected, and the Ombudsman will work with the resident's legal representative. Or follow the Ombudsman's state policies and procedures if the resident doesn't have a legal representative and cannot provide consent. Federal law grants Ombudsman access to resident information, again with resident permission, and Ombudsmen are required to keep that information confidential. In accordance with federal law, facilities must provide the Ombudsman with immediate access to residents as well. So they cannot block resident access to the Ombudsman program, and residents need to have that access by phone and have them visit in person and not have that access restricted. Ombudsmen handle a variety of complaints about quality of life and care. The most frequent complaints usually include complaints about the discharge or eviction process, the failure to respond to calls for assistance or otherwise call lights in nursing homes. Residents are not treated with dignity and respect, medication errors, accidents, resident conflict, so resident to resident conflict, and care planning process. Either the resident wasn't included in the care planning process or the facility is not following the care plan, and complaints about food. Not all complaints are about the care provided by the facility. Some complaints that ombudsmen receive and handle are about outside agencies, services, or individuals, such as the Medicaid process and getting those Medicaid benefits. Ombudsmen can receive and respond to complaints from individuals other than the resident, such as from a family member or another friend or another advocate, but ombudsmen still need resident permission to investigate and share information. Nationwide in 2014, the Ombudsman Program investigated 191,533 complaints in nursing homes and board and care facilities. So as you can see, ombudsmen handle a variety of complaints and concerns and truly are resident advocates in all aspects of their work. To get more information about the Ombudsman Program or find out how you can contact your state or local program, please visit the National Ombudsman Resource Center website. You can use the map, the image is on the screen, to search for your state and local ombudsman programs, as well as your state survey agency, adult protective services agency, Medicaid agency, and other state entities. And just so you know, nursing homes are required to post contact information for the Ombudsman Program in the facility, so you may want to look for that during your visits. And some states also require the same for assisted living or board and care. So please visit our website, the National Ombudsman Resource Center. There's a lot of information there, as well as some resources that Robin will go over at the end that are available on the Consumer Voice website. So I'm going to move directly into our question and answer portion of the webinar. So let me open up the chat. I could see that the chat messages were coming in as I was speaking, but couldn't address them while I was talking. So let's see what we have here. I did see this question earlier and would like to ask Julie, if you could respond to this question, Julie, by unmuting your line in a moment. A participant asked if there is a link to join the NCEA listserv that you mentioned. How do you join that?
Yes, you can absolutely email us. I think you'll be seeing the website coming in at the end of the resources, and then you could go on our website and it will have the contact us area. Just go on there and then you'll be able to contact us about subscribing to the listserv. We would love that.
Great. Thank you so much, Julie, and thanks for that question.
Thank you.
Okay, just one second. Let me, yes, if someone asked about printing out the slides, I can answer that one for you right now. Yes, the slides and the webinar recording, as well as additional resources that we mentioned today, will be on the website, and you'll be able to print them from your computer. So we had another question, and I did respond to it via chat, but I'd like to address it on the phone as well. The question was, does individualized care include dietary preferences within an assisted living facility? And like I said, I responded individually to the person that asked the question, and thank you for asking that question. It's a really good one. But I wanted to share it with everybody too, because other people on the line may have this question. My response was yes, individualized care should include dietary preferences, whether you're in a nursing home or an assisted living facility. However, the caveat is that all states, like I said earlier, have different regulations and resident rights, whether you're in assisted living compared to nursing homes. So you would really need to go back and refer to your state requirements when it comes to resident choice, preferences, dining, meal options, and so forth. So I know that doesn't really drill down to that level for your question, but you would need to check with your state regulations and requirements. And again, you can actually link to that information or speak with your state or local ombudsman program would be a great resource for that. So thank you for that question. Let's see. And if you have any questions, I'm going to go through the chat questions we've already received, but if you have them, just keep them coming in or raise your hand and I can call on you and unmute your line as well. Okay, so this is a question, and maybe Robin, you can help me out with this response as well. This is a pretty common question. Can a resident be discharged from physical therapy because his or her medical insurance no longer pays for this service, yet the resident feels that he or she would make additional therapy would be beneficial? So it depends, again, what the insurance is and who that provider is that's covering the physical therapy. But just to use an example, if the resident is in a skilled nursing facility that's providing physical therapy and Medicare is paying for those services, and let's say that the nursing home says that the payer source, Medicare, that they have exhausted all those payment days for physical therapy and they'll no longer be receiving that, yet the resident feels they benefit from it, there is an appeal process for Medicare and for those services. And your ombudsman program would know what that appeal process is for your state, because it is state dependent about that appeal process and who to talk to. And that appeal information should be in the notice that the facility gives the resident that that physical therapy would be discontinued, that skilled therapy. If that happens, and if the appeal isn't won and Medicare is not going to pay for that, there still are some steps that should be incorporated in that resident's care plan to help range of motion and make sure that they don't decline further, that they should maintain whatever level and even improve if possible from where they were when their physical therapy was discontinued. So Robin, do you have anything to add to that? I'd welcome any feedback.
Oh, I'd be happy to. You did a great job of answering that question, Amity. So I'm just going to add a couple of additional points. One is that if the facility is going to stop providing those therapy services, as Amity said, you must the resident must receive a notice that services will be stopped. This is separate from any kind of discharge notice that must be issued if the facility is going to, discharge the resident to another or transfer them to another facility. So two different notices here. And as Amity said, I just want to stress on that notice, there should be information, it's required to be information about how to appeal. So yes, there definitely is recourse. The other thing, it's a slightly different issue, but I just want to reinforce that families, residents often hear in therapy that, well, the resident is not improving anymore, the resident is plateauing, so we cannot provide any more therapy services. So we cannot stress enough that this is not true. It never has been true, but it became such a pervasive myth that, in fact, the federal government was sued to clear that myth up. So it's called the JIMO case, and so I just want to stress that if you ever hear that therapy is being discontinued because the resident can't benefit from anymore, that is not the case, and you should bring that up, and you should notify your ombudsman for assistance if you continue to have difficulties with that. Therapy can be continued if it helps to maintain a resident's abilities. So I just wanted to add that point because despite a lawsuit and information that has been distributed to Medicare and to providers, this continues to be a problem. So
thank you. Yes. Thank you so much, Robin. That was really helpful. I knew you'd be able to add a lot more background to that, so thanks. Another question that some of you may have that we received was, where do you find the star rating for a facility? And that's the Nursing Home Compare, is the 5-star rating system that I believe you're talking about. And you can access that on medicare.gov and then look for Nursing Home Compare. So hope that helps. Let's see. We received another it's not really a question, it's a statement, but I did want to share it with you because I don't want some of you to walk away with misinformation. But someone made the comment that APS will only respond to nursing homes if financial abuse occurred while the client was in the community, and or if that financial exploitation is continuing once the resident's in the nursing home due to jurisdictional issues in that state. Thank you so much for sharing that. Yes, again, APS, Adult Protective Services, every state runs their APS program differently and provides services differently, almost similar to the Ombudsman program, and how every state, how they operate those services are slightly different. So for example, in one state, APS will go into nursing homes, like you said, to investigate financial exploitation if the person exploiting the nursing home resident is not a staff member of that facility. So for example, if the family member is supposed to be paying the resident's bill out of the resident's the resident's account, and they don't do that, and they mismanage the funds or use the resident's funds, then APS would investigate that. APS in some states also goes into assisted living and board and care homes to investigate abuse, neglect, and exploitation. So again, just so you walk away with this, every state, their structure for investigating abuse, neglect, and exploitation it operates differently. So APS will have different jurisdiction, and licensing and certification will. And not only will they have different jurisdiction, they'll have different responsibilities when it comes to investigating abuse, neglect, and exploitation. So again, that's one of those state-specific things that you need to go back to your state and figure out who does what and how they do it and what it really looks like in your network. So I hope that helps. And Julie, if you have anything to add about that, feel free to jump in.
I think you handled that perfectly. That was my comment, that every state's different and the way the APS functions varies definitely.
Great, thank you. Let's see. A good question, so many good questions. Are there any regulations, state or federal, governing so-called adult independent care communities? Robin, do you want to take that one?
Adult independent care community. So I'm going to interpret that as meaning independent living. And for the most part, again, I can't guarantee this, but for the most part, there certainly are no federal regulations at all. And to my knowledge, there are not state regulations either. So to the extent that I know, there's nothing governing those independent living centers. Amity, would that correspond to your experience?
Yes, it does.
And this is Julie. Also, just remember that those people you would be contacting adult services because they would be out in the community. So depending on, like in California, there are some, depending on their status as a residential care facility or depending on the varying degrees, where there might be some oversight. But yeah, I think for the most part, anything independent is like an apartment building and would have that of landlord-tenant type of situation happening.
Right. Sometimes if services are brought in, for example, maybe through a home care agency, then the home care agency is likely to be licensed and perhaps even certified. So there could be some oversight there. But as Julie said, in essence, they are apartments.
Yes. Thank you so much, Julie and Robin. To second that, yes, look at landlord-tenant laws. Contact APS in those situations if it's involving abuse, neglect, or exploitation. If it's a complaint about accommodations, then it is possible maybe that there's some ADA compliance issues that could be addressed, and so maybe contact the State Protection and Advocacy or another disability advocacy organization in your state or locally. That would be another way to approach that for federal regulations and state requirements. So, good questions. Let's see. One more question. What's the best tool for advocacy when residents are not happy with menu options and have voiced concerns, but facility states they must follow the menu the corporate office provides, and then the corporate office will not change the menu? Great question. From an ombudsman advocacy perspective, what I've seen work in facilities in the past came from the residents. There was one ombudsman that was working with a particular facility that actually helped the residents start a petition about the menu choices and options and wanting to have more snacks available and more varieties of snacks and more options for meal choices and so forth. And then that petition was presented, of course, to the facility administrator as well as the corporate office. So and I completely understand, I'm sure these residents probably even worked with resident council or maybe as a group, but for some reason that petition spoke volumes and they were able to make some changes. Another option would, having the residents communicate directly with the corporate office, track down the contact information for that corporate office and work with the residents in communicating their concerns directly with the corporate office instead of going through the facility administrator and sending that message up to the corporate office. Those are the two things that have worked in the past. Another example would be some facilities that have really embraced culture change, which culture change is simply a way of making sure that the environment is more resident-centered and resident-directed in all aspects of care, including menu planning. Some residents were successful in getting on a menu planning / food committee, and they would work together with the facility staff in planning out the menu, making sure that there were some special resident choice only days where they got to choose, vote on a meal and the resident council, and that would be on the menu. So there's a lot of advocacy strategies that could be used, and it's really, really powerful when it's coming from a group of residents. It speaks really loud and really clear. So those are some options. Of course, if the residents are not seeing that the corporate office is responding to their concerns, and that is a requirement in the federal requirements that they have to respond to concerns, then they could also speak with the state survey agency and lodge a complaint to the state survey agency. So those are just a few strategies. There's a lot more empowerment and advocacy strategies available on the Consumer Voice website, as well as some examples of culture change and getting residents involved in menu planning and that quality of life. So Robin, did you have anything you'd like to add, or Kathy?
This is Robin. I think you did a fabulous job of covering the range of options. I would just add that getting back to strength in numbers, I've seen times when resident councils and family councils have joined together. So that might bring some extra weight to communicating with corporate office. But I think you've covered all that I can think of.
Great, thank you. Excellent tip. Kathy, did you have anything to add?
Yeah, Amity, I would just add that facilities are also supposed to accommodate individual preferences and don't necessarily have to change a whole menu to satisfy one or even a number of residents who have individual preferences that are not in the routine menu. They're supposed to accommodate those individual preferences as well.
Yes.
And again, you've got the weight of the regulation behind you in advocating for that. We had to do that with our mother, as a matter of fact.
Exactly. Thank you very much, Kathy. So there was a comment that came up, and I think it was based on the question about the independent care communities. saying that HUD subsidized facilities do have regulations, and you're exactly right. So thank you for bringing that up. If those apartments are receiving HUD support and they're subsidized facilities, then there are some federal regulations for that. So let's see, I think we have time for one more question, and then we're going to move back to Robin so she can share some resources and close it out. So let's see. The question was, does this apply to Medicaid as well as Medicare? Yes and no. If you are a resident or have a loved one in a nursing home, then yes. If the facility is certified for Medicaid and Medicare, then all of those federal regulations apply. So, and it not only applies to the residents receiving Medicare and Medicaid, it applies to all residents in the facility regardless of payer source. So if there's a resident living in a nursing home that's paying completely out of pocket, they're completely private pay, all of those rights and regulations apply to that individual as well, because that facility is certified in both Medicaid and Medicare. So, and then there's also very new home and community-based services requirements that applies to Medicaid spending in the community for some community services. And Robin, did you want to just briefly touch on that and then let them know where they can get more information for that and on the Consumer Voice website? And then I'll hand it back to you.
So as Amity said, there are new rules that apply to folks who are receiving services in the community through Medicaid waivers, and also that would apply to basically assisted living facilities that are receiving Medicaid. And a lot of there's a real focus on person-centered planning in these regulations. So they really reinforce the fact that it's the consumer who should be guiding the process, and they really support what the individual wants and their preferences in putting together the care plan. There are also regulations that speak about choice and privacy and involvement in the community. I would say that in a residential setting, there are an additional set of requirements that apply. And some of those include the fact that there has to be privacy, there has to be a locked door, there has to be access to food 24 hours a day. So the effort here and the intent here is to really make the services that are home and community based truly like what those of us who live in our homes would receive, and not to really treat folks who are receiving these services differently, as if they were not part of the community, or as if they were in an institutional setting. So you should be able to find this information on our website. Can't exactly remember the link, but if you go on and look on to the Consumer Voice website and look under issues, I think you should be able to find it, or do a search for home and community-based services.
Great, thank you, Robin. So that's going to wrap up our Q&A portion of the webinar, but if we did not get to your question, I'm sorry about that. We had a ton of great questions, and thank you so much for your participation. We will be available via email, and you can always contact Consumer Voice or NORC to follow up with additional questions. So I'm going to pass it back to you, Robin, to cover some resources.
Okay. Well, thank you, Amity. So in addition to the information in this webinar, we wanted to provide you with some resources to help you in advocating for quality care. Next slide. Oh, sorry. I think we're there. So in collaboration with NCEA, we produced this new trifold brochure that we're very proud of. The brochure has the information that we reviewed today, as well as recommendations for seeking help and reporting complaints. It also has contact information for NCEA and the Elder Care Locator, which can be used to find local aging and disability services. So we really want to encourage you to use this brochure. So if you're a resident, please share this with your peers, both individually and in resident council meetings. Talk about what quality care means to you and how to advocate for your needs. If you're a family member, use this resource to inform your observations during visits. Gives you ideas about what to look for. And also use the brochure to help you in advocating for quality care. And if you're an ombudsman, you can distribute the brochure and use it to start a conversation about residents' rights and quality care during visits. So next slide. So Consumer Voice is the leading national advocacy organization for consumers receiving long-term care services and supports. And we have a wealth of information available to support consumers, family members, and others in advocating for quality care. So you see the red circle on the screen, and that shows you that we have specific information for long-term care consumers, family members, and advocates. And when you click on those tabs, you'll be directed to a variety of materials. So there's information available for residents in nursing homes, assisted living, and for those who are receiving home and community-based services. Next slide. Here you see just a few examples of the types of resources that Consumer Voice has available for consumers, family members, and advocates. So I just want to stress again, we have a wealth of information, and this is just a sample of what's available on our website. Next slide, please. As we shared earlier, this webinar and the new brochure are products developed in collaboration with NCEA, and you can find the NCEA online at their main website, their blog, Facebook page, and Twitter. Next slide. So in closing, I want to thank NCEA, sorry about that, for their support and collaboration on this webinar, and specifically Julie for her presentation earlier. I want to thank Kathy for sharing her insights as a family member and advocate. And I want to thank all of you for taking the time to join us today. The webinar recording and all the materials will be posted on our website soon. And finally, for additional resources, as we said, visit our website and connect with us on Facebook and Twitter. If you're looking for something specific or have any questions or comments, please let us know how we can help you. And also, once the webinar ends, you'll be directed to a quick evaluation, and we really encourage you and hope that you'll complete the evaluation because your feedback is extremely important to us and we take it very seriously. So with that, we wish you success in your advocacy and enjoy the rest of your day. Thank you so much.